guys, I have picked out 60 abbreviations that I commonly see in my nursing practice, and I'm going to put them up here on the video and just explain what they mean to help you as you go to university and as you start your placements. So the first few abbreviations I have are all related to medication and would most commonly be on drug charts. 4 times a day, 3 times a day, twice a day, once a day, when required or as needed. Stat is like a one-off medication that you need to give immediately. Subcutaneous, so that's an injection that goes just in your subcutaneous tissue or your fatty tissue. Oral medication or per oral. Intravenous, into the vein. Parenteral, so up your rectum, suppositories and things like that. Topical, so that's things that you put on your skin, creams and ointments. Intramuscular, injections into the muscle. Nebulizer, so it's given in a face mask with oxygen, and it makes liquid medicine into steam that you breathe in. Inhaler. IV antibiotics or intravenous antibiotics. Oral antibiotics. Intravenous fluid. Potassium. Total parenteral nutrition. So this is when patients can't have food through their stomach, they have it through their vein. It's called TPN or total parenteral nutrition. You can also have PN, parenteral nutrition, which isn't total, so they have some food in their stomach and some PN. Antibiotics. Normal saline. Peripheral cannula, so just a cannula that is in the vein to give medicine through. Long line, so this is the same as peripheral access into the vein, but the line is much longer, so they stay in for a longer time. So usually children that need IV antibiotics for say 2 weeks would have a long line rather than a peripheral cannula. NG, nasogastric, or NGT, nasogastric tube, a tube that goes into through the nose into the stomach to feed. Nasal jejunal or nasal jejunal tube, that is a tube that goes from the nose into the jejunum, which is just a little bit below the stomach, so it goes past the stomach. There's children that have real problems vomiting and things like that. The milk will go a little bit further down so that they can't vomit it up. Past urine. Bowels opened. Bowels not opened. Diarrhea and vomiting. Diagnosis. History. Past medical history. Patient. Spontaneous vaginal delivery. Nasal pharyngeal aspirate, so we just put up a tube up their nose and suck the mucus out of their nose and test that for different viruses and bacteria. Chest x-ray. Full blood count. Urea and electrolytes. C-reactive protein. That is really important. Actually, it measures the infection levels in the blood. No abnormalities detected. So when a patient goes for a test and it's all normal, they'll write NAD. Self-ventilating in room air. So just breathing normally, like me. I'm self-ventilating in room air here. Nil by mouth. Do not attempt resuscitation, or it could be DNR, which do not resuscitate. Failure to thrive. Work of breathing. Viral induced wheeze. Shortness of breath. Difficulty in breathing. Non-accidental injury. Tonsillectomy and adenoidectomy. General anaesthetic. Child and adolescent mental health service. Outpatient appointment. Did not attend. Query. So, for example, if we thought a patient might have appendicitis, we'd put query or question mark appendicitis, query appendicitis. Fracture. Left and right. So that's the 60 abbreviations that I've got written down. As I said at the beginning, there are far more than that. Please, if you come across any abbreviations in practice or at university that you do not understand, just ask. It's fine. I'm still asking now, 2 years qualified. But I hope this helped you as well and gives you a bit of a head start for starting placement. Thanks for watching, guys. See you in my next video.